Greetings, I'm Timothy from Group 15. Along with my groupmates, we will be presenting about colorectal cancer, also known as CRC. CRC is a disease in which cells in the colon, also known as the large intestine or rectum, grows out of control. It has been known as the colon cancer as well. It is one of the most prevalent cancers worldwide that develops slowly from the inner lining of the colon or rectum, with the underlying causes of mutation in three main genes: oncogenes, tumor suppressor genes, and DNA repair genes. CRC has left a significant global impact by being the third most common cancer, with second leading cause of cancer-related death. It has recorded 935,000 deaths in 2020, making it a significant public health concern worldwide. The demographics of CRC can be split into four factors: age, gender, diet, lifestyle, and also additional race. Most CRC is discovered in people aged 50 years old and above, with men as the majority of the cases. People who has a diet rich in red meat such as lamb, pork, beef, and processed meat are at high risk of developing CRC. Inactivity and smoking lifestyle do contribute to the factor. Additional risks to take note of are people with inflammatory bowel diseases, specific genetic syndromes, and a family history of CRC. Having said that, it is important for us to conduct early screening for detection of CRC, as early stages of CRC often have no symptoms. With regular screenings, precancerous polyps can be detected and removed, increasing the chances of recovery and CRC prevention.
Hi, I'm Agatha. Now I will discuss about the most common current technology for colorectal cancer treatment, which is targeted therapy. So, how targeted therapy works? Targeted therapy works by using drugs that specifically target molecules that promoting the growth and spread of colorectal cancer cells. Monoclonal antibodies such as cetuximab and panitumumab are used to inhibit the activity of epidermal growth factor receptor (EGFR) found on the surface of cancer cells that promote the cancer cell growth, while specific drugs such as bevacizumab, ramucirumab, and zigafibresib inhibiting vascular endothelial growth factor (VEGF) to undergo angiogenesis, thus reduce the blood supply to cancer cells. There are also other drugs used to target proteins or pathway that contribute to cancer cell growth, such as BRAF gene, NTRK gene, HER2 protein, and PI3K pathway. Specific drugs act as inhibitors by targeting these molecules, which helps to stop cancer cells from growing and reduces harm to normal cells in the body. However, targeted therapy has few limitations. First, it only works on specific molecular targets, and not all colorectal cancers have those targets. This can make treatment difficult and ineffective. Second, cancer cells can develop resistance to treatment over time due to mutations in the targeted molecules, so resulted in disease progression. Next, it has side effects caused by the drugs used, such as skin rash, diarrhea, and an increased risk of bleeding and blood clots, so limits its use in certain patients.
Good day, doctor. My name is Jun Chen. Now I'm going to discuss about carcinoembryonic antigen (CEA) test. I will start by giving some brief introduction about CEA test. CEA is a protein that acts as a tumor markers, and through these tumor markers, doctor could determine the severity of the cancers, the treatment that should be implemented to cure the cancers, and the effectiveness of the treatments. Unborn baby in good health conditions will have high level of CEA, but once after giving birth, the CEA level will reduce or even become zero, which indicates the CEA completely disappear from the bodies. Therefore, healthy adults should only have little or no CEA in their bodies. CEA level can be referred to determine the risk of a person getting cancer and often used to determine the possibility of getting colorectal cancers. The CEA level is examined through the blood samples obtained from the veins in the arm or fluid from the spine, chest, and abdomen, which is less common, using a small needle. Only a small amount of blood is collected into the test tube to carry out the test. CEA test is not used for screening or diagnostic purpose, but only acts as a reference. It helps to predict the effectiveness of the treatments, the status of recovery, and the probability of cancer recurrence. It has different functions in different stages of treatments. Before starting the treatments, if the level of CEA is low, it means the tumor is small and the cancer will spread to other parts of the body. However, some cancers do not produce much CEA. Therefore, the diagnosis needs to be tested to know more details. If the CEA level is high, it indicates the presence of large tumors and/or the cancer is spread. Other tests should be carried out to examine the stages of cancer. The initial value of the CEA will then be compared with the value of the CEA after treatments to determine the functionality of the treatment used. During and after treatments, the level of CEA will be monitored from time to time. If there is a decrease in CEA level, it means the treatment is working and effective. If the treatment is not working or not effective, the CEA level will increase or maintain at a high level. For colorectal cancers, if surgery has been carried out but there is no decrease in CA level, it may be due to not the entire tumor being removed or cancer recurrence occur. If there is a rise in CA level after the decreases, it might be due to cancer recurrence as well. CA test is not recommended for screening or diagnosis of colorectal cancers due to its low sensitivity and specificity. CA is not specific to colorectal cancers and can also be elevated in other conditions such as inflammation or infection or other factors. Therefore, a high CA level does not always indicate the presence of cancers, and even if the test result is normal, the person might still have the possibility of getting cancers. It has been proven that CA tests could not be fully relied in diagnosing colorectal cancers, even though the rise of CA level commonly indicates the risk of colorectal cancers. Therefore, after conducting the CA test, other tests such as colonoscopy or sigmoidoscopy should be carried out as well to obtain more specific information about colorectal cancers. In short, CA tests can only act as a reference.
Good day, Dr. I am Si Hui. I will discuss one of the detection technology for colorectal cancers, which is SDMA-FIT. For your information, SDMA-FIT is the combination of multi-target stone DNA test (SDMA) and focused immunochemical test (FIT). The function of SDMA is to detect the variants in genes that are involved in the development of adenoma, which include the following mutation, while FIT function in detecting small amount of blood present in stone by using a specific antibody. The severity of colorectal cancer is a score distribution based by having risk stratifying algorithms. The criteria of scoring system are shown here, with score 0 indicating for good health, while score 7 indicating for last-line colorectal cancers. The limitation of SDMA-FIT is low accuracies. This is because SDMA-FIT involves complicated correction and diagnosis procedures, which cause the accuracy to be highly dependent on the user's operations. Besides, the positive result of SDMA-FIT may arise for other neoplasias in the aerodigestive tract as it involves of detection for 10 biomarkers. This result in the follow-up colonoscopy be necessary for more accurate result.
Good day, doctor. I'm Jocelyn. Moving on to the improvement of SDMA-FIT. A rapid self-test kit which focuses on the FIT is developed. A conjugate of monoclonal antibodies colorant and polyclonal antibodies are fixed in solid phase at the conjugate pad of the device. It allows selective identification of human hemoglobin. A sampling stick is provided to collect stool samples onto the sample pad, which contains a reagent to liquefy the stool. The test result is positive if hemoglobin is present in the stool sample. In terms of impact, this self-test kit increases convenience to users as they will be able to obtain the test result at home a few minutes after the test is conducted. As a non-invasive test, it does not affect the patient and public safety. Besides, it saves the total cost of the test, especially the delivery fee, as the sample does not have to be sent back to the manufacturer for testing. This makes the test more affordable to users while protecting their privacy. Also, it reduces the need of resources in terms of logistics and manpower, thus increasing its efficiency and making it more environmental friendly. It is more accessible to users as it could be sold in the pharmacy like all other COVID-19 and pregnancy test kits. Since the test is conducted right after the sample is collected, the freshness of the stool could be ensured without the use of preservatives. Furthermore, it can be adopted for other diseases which involve bleeding in the digestive tract, such as polyps and hemorrhoids. To dispose the used self-test kits, the testing device and sampling stick should be kept into the leak-resistant biohazard bag before throwing them into the red biomedical waste management bin. The cardboard package and user's guide can be recycled by disposing them into the blue recycle bin. That's all from me. Thank you.
In conclusion, CRC remains a significant global public health concern. The current available treatment options are surgery, chemotherapy, radiation therapy, and targeted therapy. Based on our findings, CA tests and SDNA-FIT highlighted the importance of biomarkers that enables the diagnosis of CRC. They are crucial in monitoring treatment response and predicting patient outcomes. For targeted therapy, it's a revolution of cancer treatment that minimizes harm and side effects. However, further innovation is still needed for a less invasive approach. In short, biomedical engineers, researchers, and healthcare industrial experts are the key stakeholders as they are able to collaborate and contribute to a new detection and treatment approaches, focusing in the field of biotechnology, drug delivery, and medical imaging aspects. And that's all from us. Thank you.